Welcome back. As part of our new Takeout Takeaway series, we are delving into how President Trump's new tax and spending law will impact our lives. As you might remember, last night we discussed the measure's impact on some component of your taxes. We may revisit the tax component and other factors later on this week. Today, as I promised in the open to this show, we turn our focus to health care. A federal judge has temporarily blocked the Trump administration from revoking Medicaid coverage for non-abortion services at Planned Parenthood, partially freezing a provision of that new law that went into effect just days ago. Joining me now is Dr. Rob Davidson. He is an emergency medicine physician from Michigan and the executive director of the Committee to Protect Healthcare. Dr. Davidson, it's great to have you with us. Thanks for joining me. Just for my audience's benefit, when you diagnose the problems that may come and arise from this new law, will you be doing so as a doctor or as a partisan?
Well, certainly as a doctor, I've been a physician more than half of my life. I'm 54 years old and I graduated 27 years ago. And so I've dedicated my life, most of it, about 23 years, in a small rural community in West Michigan. And, I've been caring for these folks for over 2 decades. And I saw what happened when we expanded Medicaid in particular with the Affordable Care Act. I saw people that, several times a week, people would come in with out of control blood pressure or sugars that were off the charts and they didn't have a primary care doctor. And, you patch them up, you get them a prescription for a month or two. And 6 months later, they kind of complete, do the cycle again. And after the ACA, like truly, people got more doctors. We could expand services in our community, more primary care doctors, more specialists came up from the larger hospital in our way. It's really terrifying as a physician to think that we're going to go in reverse and so many more of these people are going to lose health coverage and going to affect the whole system in our community.
So, Dr. Davidson, I talked about potential changes, and they might be drastic for rural hospitals. You mentioned you practice in a rural community. What are the fears in Michigan?
Yeah, the fears. A report just came out saying, from our Department of Health and Human Services that between 200,000 and 700,000 people in Michigan may lose coverage. It's a big concern in a poor rural county where Medicaid is a disproportionate number of the patients' insurance. And, over a third of the people who come in the ER are covered under Medicaid. The problem is when those Medicaid dollars leave, because really what Medicaid is, if it isn't cash payments to individuals, it is paying for their health care. And when they can't afford that health care, thankfully we have EMTALA, the Emergency Medicine Treatment of Active Labor Act. People come in, we see them if they're having a heart attack or appendicitis or a stroke. But if they can't pay those bills, the hospital eats some of those costs and it gets passed on down the chain to the insurers and then eventually to other patients with insurance. But eventually the hospital has to cut back services. And unfortunately, we've seen reports and we'll see more of hospitals that are on the brink of closing, and this could push them over the edge.
Dr. Davidson, as I'm sure you did, tracking the dialogue about this bill, now law, it was said by many Republicans that Medicaid was recklessly expanded in the Biden administration, and there are people on it now who are undeserving in some way or another. They should be working, they're able-bodied, they weren't the recipients that the program was originally meant for. Somehow that they are gaming the system. That is a kind of conversational part of the congressional debate over it. That debate's now over. It's now law. What has been your real-world experience?
As a physician, I don't understand the word who deserves health care. I don't get it. To me, all of my patients deserve it, and they all get it when they come in. It's just who can actually afford to pay for it. I heard Senator Mullen talking about, there being only 35 million people under the poverty level, but 70 million people on Medicaid. The problem is the poverty level for a family of four is $31,000 a year. This bill gives a tax cut to someone making $1 million of $32,000. So you're taking money away, taking health insurance away from individuals who really can't afford it, especially in this era. I mean, of exploding health costs, and even if they can get unemployer insurance, unemployment is historically very low right now. Where are all these jobs? And if they get insurance through their job, they're going to have deductibles of $2,000, $3,000. People making $20 an hour. I know people that work with my wife as a family doctor, someone had to get surgery, take a job waiting tables on the weekends to be able to afford surgery, even with employer insurance. So the system is so expensive, and I fear the people who voted on this thing are just really out of touch with the folks that I see every day and have no idea how much people struggle.
Dr. Rob Davidson, I appreciate the time. Thank you very much, sir.
Thank you.